Hi, I'm Dr. Doty, holistic veterinarian and founder of Holistic Vet Blend. If you feed raw or lightly cooked diets to your cats, you probably closely followed the discussions around bird flu and wondered how concerned do you really need to be. Now there is reassuring news. A University of Maryland study has shown that cats infected with bird flu, also known as H5N1 or avian influenza, can survive when treated early with antiviral medication. This is the first strong evidence that treatment, not just supportive care, can save their lives. Let's look at what this means for you and your cats. In this study, 4 cats from one household near Tulare, California, an area affected by bird flu in both birds and dairy cattle, became infected. 2 cats died before treatment, but 2 others received oseltamivir, same as antiviral Tamiflu, which is used to treat influenza in people, and both cats made a full recovery. Even more encouraging, they developed antibodies that appeared to protect them for months after recovery. The key was early recognition and prompt treatment. Cats can get bird flu by eating infected birds, raw poultry, or even through contaminated milk, soil, or water. Migratory birds can carry the virus over long distances, which means risk can exist anywhere, even if you're far from a known outbreak. If your cat hunts, spends time outdoors, or eats raw poultry, awareness is your best defense. The first symptoms can look like any other illness, but they can escalate quickly. Watch for loss of appetite, lethargy, fever, tremors, watery eyes, nasal discharge, or labored breathing. If you see these, contact your veterinarian right away and ask them about early antiviral treatment. That conversation could make all the difference. The cats who survived received early treatment with oseltamivir, also known as Tamiflu, along with supportive care. They made a full recovery and maintained antibodies for several months afterward. This gives veterinarians a new path forward and gives cat parents hope. Many of my clients, and I include myself, feed fresh or raw food because we believe in minimally processed nutrition. But bird flu reminds us that how we feed is just as important as what we feed. During active outbreaks, I recommend lightly cooking poultry to reduce viral risk while preserving nutrients. Beef, lamb, and pork are lower risk proteins for avian influenza. It's not about abandoning fresh food, it's about adapting responsibly. This is more than just a cat health issue. It's a One Health issue, where animal, human, and environmental health overlap. When viruses jump between species, they evolve. By recognizing and treating infections early in our pets, we help protect the bigger picture, our homes, communities, and ecosystems. A colleague recently said, well, only a few cats have died. And while that's true, if one of those cats was yours and you could have prevented it, how would you feel? I was so glad to see this study as it gives us hope and a clear action plan. Feed smart, watch for symptoms, and act quickly if your cat becomes ill. An educated One Health approach means understanding how our choices for our pets ripple outwards to other animals, people, and the environment we share. When we stay informed and act responsibly, we don't just protect our cats, we help create a healthier world for all species. If you found this helpful, please like and subscribe for more insights on holistic, evidence-based pet health, and I sure would appreciate it if you would share it with your friends. Maybe it'll keep someone's cat safe. Until next time.